Hello and welcome to the tip of the day. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws and Hooves Mole Veterinary Services, and San Francisco Stables. And we're helping El Paso help their pets. So today I want to talk about home monitoring of your pet's respiratory rate. And basically this is for your cats and dogs. And the reason why you would do this is so that you can have early detection of respiratory problems such as pneumonia and specifically congestive heart failure. Congestive heart failure is when the heart is not functioning as well, and so you start to get fluid build up in the lungs and your pets start to cough. But even before that, before the coughing happens, then you'll start to see an increase in the respiratory rate. So basically the pets breathe faster when they're resting. And so this is actually very diagnostic and can point to problems early on. And so if you do see an increase in that, then you want to get your pets in. We'll do an exam and do some chest x-rays to try and see what's going on inside. So basically there's two ways to do it. One is called the resting respiratory rate, or RRR, and that's done when your pet is truly resting. So it has to be done not when they're anxious, not when they're panting, not after they've exercised. They truly need to just be hanging out, laying on the couch or on the floor while you're watching TV or something. And that's the resting respiratory rate. The other is the sleeping respiratory rate, which is done while your pet is sleeping. It needs to be done at least 15 minutes after they've already been asleep so that they're in a full, deep, calm sleep. It can't be during active sleep when they're paddling, swimming, or dreaming. So some studies show that the sleeping respiratory rate is a little bit more accurate. So that's the one I would recommend if you can. But again, it needs to be when they're truly fully asleep, 15 minutes after they've fallen asleep. Basically what you do is while your pet is laying on its side, you watch the rise and fall of the chest. And so you count every time the chest rises. And you need a time clock, a stopwatch, and you want to count for 30 seconds. And then you'll multiply that by 2 to get a full minute. And you'll keep a log of that, keep a little notebook and keep a log and bring that log to your vet when you come in next. So basically while your pet's asleep, you have, a stopwatch. You can do your phone or whatever. As soon as you click the start, then you start counting the rises. So 1, 2, 3, etc. And then as soon as it gets to 30 seconds, then you stop. And that count you multiply by 2, and that's your sleeping respiratory rate. Anything between like 6 to about 20 is totally normal. You can get your pet's average of about 14 is common. And if it gets up in dogs higher than 30 and in cats higher than 35, then there's potentially an issue and you need to bring your pet in for an exam. This is really good for older pets, especially the breeds that do tend to have congestive heart failure, but really good for any pet because any pet can start to have lung issues like pneumonia and stuff. So just a good monitoring tool to do at home. You can keep a log. If you have any concerns, bring your pet in. We'll do an exam and some chest x-rays and get to the bottom of the issue. If you have any questions, give us a call. We're more than happy to help you. And I hope everybody has a great day. Bye-bye.